Well, good morning, everyone. So glad that you could make it today. My name is Tara Kendrick. I'm here with Bill Witt, and we are part of Senior Resource Center. And today's topic is Medicare enrollment choices. These are choices that you have to make annually, and we wanted to show you a step-by-step way to use the website medicare.gov. So this webinar is part of our SRC University live webinar series, and we do these webinars to give people some retirement education. A lot of our topics are from our book, so you're always welcome to download our book for free, or you can purchase it for only $5 and shipping, but the book is free. We try to make these sessions about 30 minutes long, and you can listen to them when we have them live or available on your schedule when we have them posted on our website. And our ultimate goal is to help create a safe, secure retirement for the people who come see us. And the good news about our school is there's no final exam. All right. So this is a portion of our, just one of many of the webinars that we've been doing over the summer and the fall. And if any of these topics are of interest, please feel free to join the SRC University on our website, and you'll have access to all of these previous webinars. So last week we covered Medicare choices in 2025, the coverage, cost, and change. And today we're going to kind of touch a little bit on that just to kind of do an overview, and then we're going to walk through the medicare.gov website. So at Senior Resource Center, we help in 4 distinct ways. We do comprehensive retirement planning, and that is helping people look 20 and 30 years in advance and making sure they're not outliving their money and finding strategies to stretch their money and grow their money safely. We also do tax planning to help people find ways to pay less tax. We do a lot of long-term care planning, so that means helping people with federal and state programs to qualify for Medicaid and VA aid and attendance. And then we do estate planning. We're not attorneys, but we just walk people through, making sure they have their legal house in order, whether it's now or when they pass. So, Bill?
Okay, thanks, Tara. Hey, welcome, everybody. Well, this is kind of a follow-on to what we did last week. As Tara mentioned, we talked about making choices, and today we really want to talk about the enrollment process, how you actually get signed up for the individual modules. And as most people find out, as we get into age 65 plus, having the right health insurance through Medicare is really critical to having a safe and secure retirement. And the choices you make up front can have long-term implications. So want to make some very wise choices as we do it. This is a chart that we created a number of years ago. And if you're 65 plus, you're getting the Medicare and You book from the federal government, which is a nice book, but most people don't want to read 140 or 150 pages of small print to understand their options. So we put together this simple one-page summary, essentially, of what your Medicare options are. On the left side of the page, we have Original Medicare, and at the bottom, you see Parts A and B. Those come from the federal government. Part A is your hospital coverage. It's free. There's no monthly premium. On Part B is your doctor and lab coverage, and it has a monthly premium that is based on income, but most people this year are paying $174.70. Often that's deducted from their Social Security check. Now, the numbers that are highlighted in yellow are in yellow because they are 2024 numbers. The Centers for Medicare and Medicaid have not yet released the deductibles and the numbers for 2025. So just remember that that 174.70 will probably go up a few bucks next year. When you look at this chart, so on the left side we have Original Medicare, A and B from the government. Many people, I'm one of them, have added on a Medicare supplement or what's called a Medigap policy. And that's a policy that comes from a private insurance company, and it pays part of or all of what Part A and B don't pay. Today, if you're on a Plan G, that's a good example. It's a great plan. It has one exposure point, which is $240, the annual deductible for Medicare Part B. So if people have A and B from the government, a supplement, a Plan G, when they go to the doctor or the lab, they're going to pay the first $240. After that, they're bulletproof the rest of the year. If they go to MD Anderson for substantial chemotherapy or cancer treatment, or if they have expensive surgery, it's all covered because the supplement fills in what A and B don't pay. Now, on the left side, you also see the fourth box on top. And that box and what's on the right side of the page, the Medicare Advantage plans, they were added back in 2006. And so what we have on the left side, we have the prescription drug plans. You get A and B from the government, a supplement, and then you go to potentially another insurance company and add on a prescription drug plan. And we'll talk about Tara's going to take us through how we use Medicare.gov to pick the most cost-effective drug plan. What about on the right side of the page? Well, this is the privatized version of Medicare. What do I mean by that? If I'm on the left side, original Medicare, and I go to the doctor sends a bill to the federal government. They pay 80% of my doctor visit. The government then looks and says, well, Bill's on a supplement, so they route the claim on to my supplement company. They pay 20%, and a week later, I get a bill saying the government paid 80%, my supplement paid 20%, I owe zero, I file it away. Well, what about Advantage plans on the right side? Those are privatized versions of Medicare. I still pay my Medicare B premium, but all of the claims on the right side go to a private insurance company. Could be United Healthcare, Blue Cross, Aetna, Cigna. There's 43 Advantage plans available in Texas next year. So as we compared last week, what's the difference between left side and right side? On the left side, I'm paying a premium for my supplement every month. So I'm essentially prepaying for my medical care. But once I've paid that supplement premium, beyond that, I have very little out of pocket. On the left side, as little as $240. What about on the right side? Well, there's 43 Advantage plans in Texas next year, and Tara's going to show us through the Medicare.gov website how we go about finding one. And these plans, many of them have no premium, so you're money ahead up front. But what you need to know is there are copays and potential deductibles as you start using your Advantage plan. And as we talked last week, the out-of-pocket maximum next year on the Advantage plans ranges anywhere from about $4,000 up to about $14,000, which is quite a bit of money. So we want to go through and do a comparison. So you're either going to be left side or right side. And either way, you want to go back to the Medicare.gov website every year during this open enrollment period. If I'm on a drug plan, I want to maybe pick a different drug plan that's more cost effective. If I'm on an Advantage plan, I want to do the same thing. So doesn't matter whether I'm left side or right side, we all want to go to Medicare.gov to do our comparison. So on supplements, signing up for a supplement is pretty simple. People call us up, we talk to them about supplements. If they want our help to get one, we can actually do the application over the phone. We ask a number of questions and we fill out the supplement application. After we've completed it, we hit a submit button, and whoever our client is gets an email from the company that says, hey, we understand you want to sign up for a supplement. Is that correct? And if you click yes, I want to sign up for the supplement, then the application goes through. So it's pretty simple. You sign up. Today we talked to most people about plans G and N. There is a plan F up there, but you had to be 65 by January 1st of 2020 to get a plan F. That's what I'm on. Plan G is like the little brother of plan F. Very good plan. The only exposure is that $240 annual deductible for Medicare Part B. For people on a tighter budget, we talk about Plan N. That can offer some cost savings for them. They do have some small copays, a $20 copay if they go to the doctor or a specialist, and a $50 copay when they go to the emergency room. What about drug plans? Well, that's the fourth box on the left side of the page. And as we mentioned, you want to compare plans annually. And this year is a big change. What's coming up in 2025 is a huge change in Medicare drug plans. Last year in 2023, there was no out-of-pocket maximum on drugs. This year, it's $8,000, which sounds like a lot, but if you're on a cancer drug or some very expensive brand name drug, you can hit that $8,000 pretty quickly. Well, next year, they're reducing the maximum out-of-pocket down to only $2,000. And because of that, the premiums on some of these plans are going up. So once again, everybody needs to shop annually to make sure you're still on the best plan. Don't get lazy, don't procrastinate. Even if you like your plan, you may like your wallet more. That's what I do. So every year I always go back to Medicare.gov and compare. Now, on the right side, we talked about Advantage plans. There's a number of options here. 4 types of plans. PPOs, where I can go in or out of network. You always want to make sure your doctors are in the network so you pay less. If you're on an HMO, you have to be in network. You go out of network, you'll pay the full cost of the medical care. And then there's point of sale programs, which are not real popular, and then special needs programs for people that have special medical conditions or are both Medicare and Medicaid eligible. They're duly eligible. And we can help explain some of the questions. We don't offer Advantage plans, and we stopped selling them after about 3 or 4 years because many of our clients complained that, hey, my doctor's not in network, I've got to find all new doctors. Or, hey, Bill, there's hidden costs that I wasn't aware of, and I don't like surprises. Most of our clients don't. So this is kind of the overview. Now I want to turn it back to Tara, and together we can talk about using this Medicare.gov website, which you're going to find is very simple.
Okay, so I'm going to share the screen so you can see it. I'm going to make it a little bit smaller so it fits in there. Okay. All right. So let's see. I want to make sure everybody can see it. Okay. There we go. All right, so let's take a look. So this is really easy. It's Medicare.gov, and all you have to do, so you just scroll down. So it says it's open enrollment now through December 7th. Find plans. So
and by the way, if you pick a plan and then later change your mind, it's the last enrollment during this open window. So recently I had a client that was signing up for a drug plan and they picked the wrong plan, called up in a panic and said, what do I do now? I said, just go back in and enter another application. The final application will determine what you're on for 2025.
Oh, that's good to know. I didn't know that. That's good to know. Okay. So if you go up to the top, you see it says health and drug plans, then you can come over to the left and click find health and drug plans. So we're going to click on that. All right. So now you have 2 choices here. You can log in on the left, so you can create an account. And the nice thing about creating an account is you'll create a username and password. And so let's say you have more than like 3 drugs. Maybe you have a whole list. It can be, time consuming to have to fill them all in. But what's the nice thing about this is when you create an account, it will actually save all your drugs and all your pharmacy choices. And so you can go back in and change them every year and just update it versus having to type them all in again. But for our example, what we're going to do, and if you just want to test the waters and try it out, you don't have to log in. You can continue without logging in. So we're going to add our zip code. We're going to look for 2025. So I'm going to do 78759. And that's in Travis County. And then I'll hit continue. Okay, so what am I looking for? Well, I already have a supplement plan. So I signed up for Part A, Part B. I signed up for my supplement plan. I already have that. Now I want to get a Medicare Part D drug plan. I'm going to click Find Plans. Okay, do you get help with your Medicare health and drug costs? I do not. I'm not on Medicaid or a Medicare savings program. So I'm going to click I do not get help from any of these programs, and then hit Continue. Do you want to see your drug costs when you compare plans? And I highly recommend you do this so you can see how much you're going to get charged per drug. And then we're going to click next. Okay, so here's the page where you're going to add your prescription drugs. You're going to do this one at a time, and they have them all listed in here. So once you start typing it in, it will pop up. So let's try Lipitor, Liptor. Okay, there it is. I'm going to click that. I'm going to hit add drug. Okay, so this is telling me that this drug is actually a generic. Would I like to add the generic? Well, of course, I'm going to add the generic because it's less expensive. So we're going to do add generic.
But you have a choice. If your doctor strongly recommends the brand name version of a drug, you'll pay more. It'll probably have higher copays, but you have the option of picking brand name or generic.
Exactly. So I'm actually on the 80 milligram. So I'm going to click 80. I take it once a day and I refill my prescription every month. So I can change this. So let's say I do a mail order and I get a 6, I only have to take it, every 2 months, every 3 months, every 6 months, or maybe I take it twice a day. So I would put 60 tabs. So you have the ability to change all this. So what you want to do is you want to have all your pill bottles out and you want to make sure you're, using what that says on your pill bottle. Okay. So I'm going to hit add my drug list. Okay. Here's my first one. All right. Now I'm going to go to add another drug. All right. Now I'm going to type in
Lisinopril.
Spell it
Lisi.
There it is, lisinopril.
And the nice thing, you type the first 3 or 4 letters and up come all the drugs starting with those letters, and you pick the one you want. And let's put 5 milligrams. That's a good choice.
And once a day.
That's good.
Okay. And then here's again the button at the top, add another drug. So we're going to put 3 drugs in here. Sertra, sertraline. Add a drug. Okay. And I take the 25 once a day, add to my drug list. Okay. So those are our 3. We feel good about it. 30 every month, 30 every month. We have the right dosage, and they're going to come down here and we're going to click done adding drugs. Okay. So now we get to choose up to 5 pharmacies to compare. So if you have a particular pharmacy and you know the name of it and you want to look for it, you can do that. Or you can do it by distance. So let's say I know that my pharmacies are within a 5-mile radius. I'm going to click on that. Okay. So it's doing 5 miles of the 78759 zip code. So what I like to do is I like to pick all the big box pharmacies. So let's pick an H-E-B. Let's pick a CVS. Let's pick Walgreens. Okay, and let's see. Let's pick well, that's going to be the same. Let's do, I'm going to go 10 miles. And I'm just going to, because I want to add Walmart. So we got H-E-B, CVS, Walgreens. Let's see what's next. We could do Randall's.
Let's not go hog wild here, Sarah.
All right. So there's your 4. Okay. And you have option to put 1 more. So we're going to hit done.
So what we did was now we came in, we didn't create an account. We put in our zip code. We put in what county we're in. We said we want to compare drug plans. We could have said Advantage plans if we wanted. We then answered the question, we don't get extra help from the government. We want to see our drug costs. We built a drug list, which is step by step. You build them one at a time. And then we picked a pharmacy or pharmacies.
Right. And if you up on your left, see it says you're viewing 2025 plans. You want to make sure you see that, while we're in this open enrollment. Okay. So what it's going to do is it's going to rank these plans. There's 10 of 15 that are available with my drugs. So my lowest drug plus my lowest premium cost. Now you can change it to how much your monthly premium is or the yearly drug deductible. But we find that your lowest drug plus premium cost is how much, that's the lowest you're going to pay out of pocket for the year for everything. And it ranks them from least expensive to most expensive. So of course, you see, here's well value script. Monthly premium, 0. Total drug premium cost, 0. Deductibles, $590. Let's go to the next one. Okay, WellCare Classic. Monthly premiums, $330. I have a total drug and premium cost is $77.40, and I have a deductible.
Once again,
So
You
now
know,
it's going,
we tell
bigger and
people,
bigger.
don't worry about the premium. Don't worry about the deductible. Look at that middle number. That's the number your wallet's going to be lighter at the end of the next 12 months throughout all of 2025. And you'll see each one of the plans has an enroll button next to it. So if we find a plan we like, all we have to do is click that and then enroll in that individual plan.
Right. So let's go, we'll look at, so now what you can do if you want to play around with this more, you have your monthly premium, your drug cost, your deductible. You can come over here to pharmacies and let's view our pharmacies. Let's compare. So here I have atorvastatin, lisinopril, and sertraline. They're all generic. And look, all of these pharmacies are preferred. That's great. So look at this, $0 cost out of pocket for every, H-E-B, CVS, Randall's, Walgreens. So all of these, I mean, this is a really easy one. You can see all the way down. It even breaks it down by month. So this is obviously the plan that you would want because you're going to have no cost out of pocket. Let's say we choose the next plan down that's got a premium and a deductible and some total cost. So let's try that. View your pharmacies. Okay. All in network. But if I went with this drug plan, out of pocket yearly, I'm going to have $64, $64, $64. Total yearly cost is $192.60. Okay. But let's look at the difference. If I go to CVS, to fill my prescriptions, total out of pocket for the year is $37.80. If I go to Randall's, I'm going to pay $203. If I go to Walgreens, I'm going to pay $91.80. So it's real important that you come in here and you say, okay, which pharmacy do I need to be going to fill my prescriptions? For me, I'd go to CVS. That's the least expensive. So there you have it again. If my total drug plus premium cost with H-E-B is $232, $77 for CVS, $243 for Randall's, and $131 for Walgreens, I'm going to go to CVS. And then it breaks it down by month. So every month. So sometimes this really matters, especially if you have a very pricey drug and you fall into that window where you've met your $2,000 deductible, say in January, and then you'll see this be $0 all the way down. All right, so we can come back up here after you look at that. Again, you can't screw this up. There's nothing that you can do. You can start over, you can close it out and begin again. It's okay. The only thing that's going to make it solid and concrete is you hitting this enroll button.
Okay, and let me toss one more thing in. We're comparing plans right now by their annual cost, but you notice each one of these plans also has a star rating, either 1 to 5 stars. And so this is the other point of comparison between the plans. Each plan has a star rating. If the plan that's the winning plan, the lowest cost plan at the top, has 3 stars or better, take it. It's a good plan. But if the winning plan financially has 1 or 2 stars, that tells us some people have been beefing, that maybe they weren't happy with the plan. And Tara's kind of scrolling down looking.
Yeah, here's one that's like 2.5. I probably wouldn't go with that one.
Yeah, it's just it tells us that people have been maybe had some complaints, had some issues. But if a plan has 3 stars or better, you don't need a 5-star plan to be a happy camper. If it's got 3, 4, or 5 stars, take the lowest cost plan at the top of the list.
That's right. So let's say I'm ready. I feel good about this plan. I'm going to hit enroll. Now it's going to tell me, okay, you're joining WellCare Value Script, join plan. Now I can't go through all this because obviously I'm not joining the plan, but you're going to put in your Medicare number. You're going to answer all these questions, and then it'll go through, it'll ask for obviously your name, address, all that stuff. If you want to do a EFT, it'll ask for your banking information, and then you'll be set. And so let's say you're on a plan for 2024 and you come in here right now to look for your 2025 plan. And you see that your 2024 plan is way down here. I was on Silver Script Choice. Wow. I don't want to pay $793 next year. I'm going to switch. So when I switch and I hit enroll in this WellCare plan, it will automatically disenroll me from my other plan. And so
At the end of the year.
yeah, at the end of the year at December 31. So I don't have to call up my Silver Script plan and tell them I'm canceling. It'll automatically cancel it for me. The other piece, just for fun, is if you come over here to this right, I can view, based on my drug list, the Medicare Advantage plans in my area. Okay, so here, this is the best plan for me, ARP Medicare Advantage from UHC. Okay, so I have no drugs, no problem.
Now,
No
once
drug
again,
cost.
when you look at an Advantage plan, how is it determining that annual cost?
It's determining it by the drugs.
Yeah, because it doesn't know how frequently you're going to go to the doctor, if there are copays or deductibles or all that. So the comparison of the Advantage plans is based solely on drug costs as well.
Yeah. Now it does show, you know, what your copay and coinsurance would be for a doctor or a specialist. Here's your, you know, drugs and drug costs. Here's some of the plan benefits. And again, we've talked about this: vision, dental, hearing. These are all discounts. They are not insurance. So you have to remember that. You have here's your in-network services for your deductible.
That's the maximum you'd have to pay. If you, let's say you need a lot of medical care during the year, you could be out of pocket $5,900 if you're in network on this plan.
Right. So one of the things we'll say is, like, if you choose to, you know, do something like this, you just want to make sure that the doctors that you want to go to are on this plan. And just because they take United Healthcare does not mean that they take this particular Medicare Advantage plan. You need to call to be sure. Otherwise, you're going to end up having to get all new doctors. Where with a supplement plan and then picking a picking a Part D plan, when you're on a supplement plan, as long as they take Medicare, they take your supplement plan. So, you know, again, you can back out of all this and, you know, go back to the beginning. There's no right or wrong. This is a really great website. So here's the beginning now. You can find plans. I always like to go up here and then say find health and drug plans. I like to start there. And remember, this is open until December 7th. So we have October 15th to December 7th to make these changes for 2025.
Yeah. Sometimes people ask us, hey, Bill, I know what I'm taking now, but what if mid-year 2025, my doctor puts me on a different medication? Well, each plan has a formulary. What is a formulary? Each plan has a list of covered drugs that are included, and those drugs are spread out over a number of tiers. There's a preferred brand, non-preferred brand, preferred generic, non-preferred generic. There's specialty drugs. So it's possible that the doctor puts you on a drug mid-year that is not covered by your plan's formulary. With most of the plans, you can go in and say, hey, I'd like to ask for an exception for the remainder of the year. And so mid-year, a doctor puts me on a drug that my plan doesn't cover. I can request an exception. It's not guaranteed that they'll issue it, but if they want to provide great customer service, usually they try to be flexible. So then I'm on that new drug until the end of 2025. And once again, each year we want to come back to this website to make sure that for the coming year, I'm still on my best financial deal.
That's right. And that's why you always update your drug list when you come on here. Okay.
Well, we covered an awful lot today, Tara, that this is a vital part of making sure that we're spending the least to get the best coverage on our Medicare coverage. And, you know, it's anybody that's on Medicare, we all need to come back to this website. It takes all the marketing hype out of, is this company better than that company? Last year, there were 21 drug plans in Texas. This year, there's only 15. So it tells you this market is changing, and we have to, once a year, we have to come back to this site to make sure we're doing a good job.
Yeah. And in the next couple of days, I'll have this posted on our website. So you're welcome to come back and listen to it again, pass it on to friends and family so that, you know, we can share all the good news with everyone. So next week, we're going to be going over pay less tax, and we're just showing you some tax advantage tips that we give to our clients.
Tara?
Yep.
We might want to push back 1 week because remember, I'm going to be out of town next week.
Oh, that's right. We are going to skip 1 week.
So we won't have a webinar next Tuesday. Today's Wednesday because we had to rework our schedules. Usually we have these on Tuesday, and next week I'm going to be out visiting my son in Seattle. But I'll be back the week after that, and we'll talk about ways to pay less tax, to take advantage of the tax tables and use them to your benefit. So plan on joining us in 2 weeks about tax planning.
That's right. All right. Well, thanks, everybody. Feel free to give us a call or an email. We're happy to answer any questions. Have a wonderful day.